Thank you, sir. So my previous experience has not actually been a treat and extend because given the cost of the drug, we never used to follow that regime, and it's really not very practical in our country to ask patients to come on a regime. It's difficult because there are many challenges, and we were discussing yesterday in another meeting too. It's cost, it's the caregiver bringing them, and they don't really stick to schedule unless probably they're on a trial with us. That's the only time they get to come because we are paying for their transport, we are paying for their attenders' transport, and we are paying for their drug, we are paying for their investigations. Otherwise, nobody ever comes on the time or the date that they are asked to come. So with these couple of cases, I don't have too many where I have a very long interval, really a documented interval between the treatment, but since that was the subject, just put together a couple of cases. So this is a 76-year-old gentleman, one-eyed. The other eye lost to a scarred CNVM. He complained of metamorphopsia. The vision was 6/9 at presentation. You can see SHREM there, you can see SRF, and you can also see a taut posterior hilot. So this was in March 2017. There was no clear evidence of polyps. This patient, though we did see a leakage on FA, no polyps as such on the ICGA. So this patient underwent multiple anti-VEGF injections. This was in March, May, July. You can see in spite of these several injections, the SHREM increased, the PED increased, and then subsequently there was some resolution of the SHREM, but then still the SRF remained and even the PED remained. So in September 2017, this was a presentation. We thought, we're missing something. Probably we need a change of diagnosis. We need to rethink. And then we repeated the angiography, and even then you see a well-defined neovascular net, but you can't really see any polyps here. You don't pick up any of those lesions there. So this was in again Jan 2018 and March 2018. You see persisting SRF with increasing PEDs here. So the patient kept coming back. We kept treating with whatever anti-VEGF option the patient took up at that point. And in November 2018 is when we decided that, we'll go ahead with aflibercept for this patient. And December 2018, you can see a very good resolution with the response in the PD and the SRF as well as decreased quite well with the first injection itself. So after the first injection, we followed up this patient Jan 2019 and April 2019. So that's almost, 4 months. There was no recurrence at all, unlike in the previous times when, the recurrence was very, very frequent. Here we were able to push it at least for about 4 months. There was, unfortunately, a return of the PD and the SRF here again. So this was in June 2019 is when the post second aflibercept, again you see complete resolution, and we followed up this patient till March 2022. And there has been no, recurrence of the condition. The patient is very happy with the result and continues to follow up because there's been almost a sustained response for over 2 years now. So like I mentioned, we saw excellent response in a non-responding patient and especially a one-night patient. We want to give them the best advantage that there is. This is a 65-year-old lady, 6/9 vision. As you can see here, there are multiple polyps. You can also see a BVN. There's a large PD with SHREM and notched PEDs as well. So here the diagnosis was quite clear. So straight away we went ahead with aflibercept in 2019 Jan. And about 20 to 25 days later, we also, since there were some extra macular polyps, we also went ahead and did focal. We thought we'll get more sustained response if we combine it with a focal laser here. So the SHREM resolved faster here than the PED, and also the, if you can see the images on the left are nasal to the disc. You can also see a PED there. That also started flattening subsequent to the aflibercept. So there was no recurrence of the polyps or the fluid or anything after 3 years. There was a good response in this patient with combined treatment for even the extramacular polyps did resolve very well. So I think this was last in 2019. We've kept a close follow-up again. Every 3 to 4 months or any symptoms, we ask the patient to come back to us, has had sustained response. Now, the third patient, a 70-year-old gentleman, left eye vision was 6/12. You can see here again a large PED with SHREM, and this case is an example of how one treatment approach really does not work for every patient, whether it is an anti-VEGF or whether it's laser. So since this was a little similar to the previous patient, we thought, there are extramacular polyps, why don't we go ahead and also do a focal laser. Unfortunately, post-focal laser, there was increase in the fluid. The hyperreflective material also increased drastically after the focal laser. So this we restrained from doing any more laser. Of course, it was also very difficult there given the amount of subretinal material there. So we continued with aflibercept with this patient. We took time for both the PED and the hyperreflective material to resolve. And we persisted. This was in March 21, July. We've been giving this patient injections every 2 to 3 months, and the patient kind of maintains with that amount of vision. And since the posterior pole is quite clear, the vision is also very well maintained. So this was the last follow-up. I think the last injection we gave was in Jan this year, and after Jan, we have not had to repeat injections for this patient. This is unfortunately for the right eye. So what I was showing you all along was the left eye. This patient came back in November for the right eye drop in vision, and since we had already had a bad experience with the left eye, we didn't take any risk. We gave one injection in November and the second one in Jan, after which we have really not had the patient come in for a follow-up, probably because of resolution or maintenance of the disease. So this is not like a treat and extend. It's like a patient opted treat and extend because the patient's vision has been maintained. So bilateral PCV, left eye, subretinal and sub-RP bleed, aflibercept and focal laser, but then we didn't really do very well with the focal laser here. The right eye came with the PCV and SRF and did respond well to aflibercept. So this is my fourth case. This is a 58-year-old lady. Despite this very, scary-looking OCT, the vision is still 6/9 in her. So we again went ahead and we did the angiographies to basically decide, what we're handling here and what to treat the patient with. So you can see here there is both fresh or absorbing blood here. You can see both on the image here. So this is 1 month post aflibercept. So I mean, one would expect that it will take time to respond given that there's such a severe disease here. But if you can see in just 1 month, there is extremely good response. The hyperreflective material has coming down. There's also, an amazing improvement with the PED as well. So we tend to worry as to whether we should even treat these patients or not. But given the fact that the patient had extremely good vision and we don't want it to worsen, I think we did well in giving this patient any treatment and it did well. So after the second aflibercept, again you can see resolution, and this sustained for almost 18 months just after the second injection. This is our last follow-up of that patient. So what we've seen in our series, what I've observed is that those patients with PCV and massive subretinal and sub-RP bleeds, vascular PEDs, aflibercept or in combination does work very well. Again, with a lot of SHREM, we've seen good response. We always thought that, SHREM is a bad prognostic indicator, but I think these couple of cases shows that actually SHREM can also go away with good outcomes. We saw sustained response in most of these cases with just 2 to 3 doses of aflibercept and a treatment-free period for more than a year.